Hi, good morning. Today we're gonna present to you our community assessment presentation that focus in sexually transmitted infection, age 14 to 59 years old. I'm Mary Ann Singh, and together with my group mates Glyza Rivas and Bea Rosales, that will be your presenter for today. Now I'm going to tackle the background of our community assessment. First is the parameters of the selected community, followed by the focus of the community assessment. Third is the methods or approaches, process, and tools used to meet the needs of the community development. And lastly, the sources, access of information for the community assessment and its rationale. Now looking for the main topic, which is STI. So what is STI? STI is an organism, bacteria, virus, or parasite that can be transferred from one person to another through sex or other intimate contact is what causes STI, which are sexually transmitted infection by World Health Organization 2021. Most STI are spread or transmitted by unprotected oral, vaginal, and anal sex between sexual partners. Skin-to-skin contact can spread some STIs. Our focus group are individuals between the age of 14 to 59 years old. Today, I'm going to tackle the methods, approaches used in this community assessment and its rationale. The first one is the formative assessment. It is a form of evaluation carried out at the start of a program for health education or healthy behavior. It identifies and describes the needs, resources, and capabilities of a community as the initial step in the ongoing process of program development and evaluation. The next one is the mapping. Mapping is a useful technique for visualizing the resources of the community. Is mapping. This could include community facilities such as hospitals, schools, and churches, or the pool of available labor maps. Promote a shared awareness of tangible problems and spark conversation about how to solve them. Community health worker networks, community-based groups and their goals, community-led projects, etc. are just a few examples of what might be mapped. The next one is the focus group discussion. A focus group discussion is a method for gathering qualitative data in which a facilitator leads a group of people through a series of inquiries on a particular subject. The facilitator must be able to get people talking, keep the conversation on track, and arbitrate any disagreements or arguments that may come up. And then the final or the last one is the summative assessment. It is a sort of assessment that takes place at the conclusion of a course or program. It is the process of evaluating someone's knowledge, skill, and performance by contrasting what they already know with what they ought to know, and it measures the outcomes and determines if they should be repeated or revised.
Hello, my name is Glyza Rivas, and my task is to report the part 2. This part is, we were going to introduce you to the chosen community. So first question is, what is going on in the selected community? Second, what are the community's strengths and or challenges? Third, what are the organizations or services involved and or available in this community? And last is, who are the gatekeepers and the stakeholders? How would you communicate with these people about these issues? So what is going on in the selected community? As we all know, the treatment of HIV comprises a series of follow-up visits to the clinics, undergoing laboratory tests, continuous counseling, and monitoring the intake of antiretroviral therapy. However, in this treatment, some people encounter a lot of difficulties. A lot of aspects are to be considered. The organizations and services involved or that is available in this community. The health Canada and the Public Health Agency of Canada offer many online resources to promote the prevention, the care, the treatment, and the control of STI. This includes statistics and STIs in Canada, Canadian guidelines on sexually transmitted infections, sexual health promotion, and
This is Bianca Rosales, and I will be reporting the part 3 of this community assessment report. So for the part 3, stakeholders and gatekeepers will be discussed in these slides. So stakeholders are the individuals or organizations who have interest in the issues at hand, while those who can open doors that can facilitate the program are referred to as the gatekeepers. So whose ideas or voices may not be heard regarding this matter? So the asymptomatic and the transgender people are the groups that might not be heard in this matter. First, the asymptomatic individuals. Asymptomatic patients can spread between partners covertly and result in difficulties if they aren't detected through testing and treated quickly. So this lack of knowledge also explains why. So in the previous slides, we've discussed the approaches that we used for this community assessment. So in this slide, I will just briefly discuss the strengths and limitations of the approaches that we use in this matter. So first, the formative assessment. So the importance of this approach is that it tracks the progress and gives the community a regular input. It also offers. So these are the references that we use for this community assessment report. Thank you for watching.